Hello guys, and welcome to our very first studio sessions video. In this one, we're going to talk about global health insurance. We're at a very transitional point in our lives, and I'm going to lead in because Rebecca totally did all the work on this project. I need to have something to say in this video.
And make you feel useful.
Yeah. But she was an employee for a corporation. Her job status changed to contractor, which means she lost benefits, but it also means part-time. And that also means we can travel the world internationally now and not be restricted to like a Monday through Friday 9 to 5 deal in the United States.
Mm-hmm. So when we first realized we were going to be making this transition, we weren't exactly sure when we were going to be leaving the States. So I did check into health insurance that would just cover us in America. And what that means at this time in our country is that you have to go onto the marketplace. And there are restrictions on when you can apply and register and become part of it. And
it's a joke,
if you don't
truthfully.
have health insurance in our country right now, you have tax penalties that you have to pay. So, and of course, for us, particularly having had a healthcare background, it's not something that we want to skimp on or not have. So it's really important for us to find a good plan and something that kind of fit our lifestyle. So,
and didn't break the bank.
No kidding. So when I went on the marketplace and started having a look, breaking the bank for really crappy health insurance was kind of what I was looking at. And I started thinking about alternatives. Knowing that in 2018, we were planning on leaving the country at some point.
For an extended period of
Yes.
time, guys. Not just like a 2-week trip.
No, this is not a 2-week trip. We're talking the next 3 to 5 years. We'll be out of the United States, traveling in other parts of the world.
Making videos.
That's right. And we are going to need health insurance for that. Whenever you go anywhere else, whenever you get a visa anywhere else, you have to bring health insurance with you. And so I started looking at options that would cover us in the United States, as well as once we leave and go overseas. And that's what brought us to this. I looked at about 14 different companies. I made this little table and, check marked all the boxes for all the different things they had to compare them. I ran all the numbers.
I do need to say, this is not a sponsored video, guys.
No.
This is just us sharing this really cool insurance that we found and what we've learned.
Yeah, because I started from scratch and I really had no idea what we were getting ourselves into. I read some articles that suggested some different companies, and then I found this really nice comprehensive list. We'll share it in the comments below so that you can see it as well, the different options. But I really narrowed it down to the point of 2 companies, and one was in Europe and one was here.
What are the names again?
So I don't remember the one we didn't choose.
Okay. It doesn't matter now.
The one we did choose was Cigna.
Which is kind of a household name.
It is, absolutely. And I didn't even know they provided global health insurance until I started looking. But a lot of the international travel living magazines and websites that we follow, they recommend Cigna. And then when I started looking, it's not that they're the cheapest, but they have the best coverage that I could find, particularly for what they wanted to charge us. And so the other place I would have chosen them, but they were about $200 more expensive, and they didn't have some of the extra tiny little features that I just really loved about the Cigna plan. So kind of moving into that, let's talk about what that means. For us, we had really good health insurance before. I was an employee for a native corporation, so that meant that we had federal employee health insurance, which in the United States is like the Cadillac of health insurance. And even when I was filling out the paperwork when we first signed up for it, I'm like, I think there's something wrong.
Too good to be true.
Health insurance like this doesn't exist anymore. This is like health insurance my parents had when I was born kind of insurance. So the only major difference that changed for us is, of course, the premiums that we pay, and secondly, our deductible is about 10 times higher than what it was.
But still, that's
when my
not
employer
bad.
was paying part of it.
Yeah, $3,000 a year for the 2 of us.
Yeah, it's $3,000 a year, and I actually broke the deductibles up into 2 separate components so that we could get our premiums a little lower. And the guy that I worked with at Cigna was great. I mean, he sent me like 8 different ways that I asked him, well, combine it this way, combine it that way. How about if we do these numbers? He was awesome. He never got frustrated with me, at least that I felt. And we finally found the right combination to get the premiums as low as possible.
Monthly premium to...
So we got the monthly premium to $8.97 a month. Now then, that is not just for health insurance. So let's talk about what that includes. That includes inpatient care. So if you're in the hospital, if you have to have x-rays, MRIs, CT scans, the whole 9 yards, if you get cancer, if you get pregnant and have a baby, if you have to have surgery, all of those things are covered under that. And we pay a $1,500 deductible for that portion. Then we have our inpatient stuff, and that is, our outpatient stuff. And that's like going to see the doctor, getting your pap smears, your mammograms, all of those kinds of things are covered under outpatient. And it's $1,500 deductible for that side of it. So sometimes if we don't go to the hospital, we may never pay that first $1,500 deductible. It may only be the second for our annual visit stuff. So it covers inpatient, outpatient. Then it covers emergency evacuation. Now, Ben and I have always had this kind of coverage because we live in Alaska where a helicopter ride to Anchorage is $30,000. So we've always paid for that kind of coverage, but this is included in the plan. You don't have to include it, but we chose to for obvious reasons.
And the places we're going to be traveling, seriously,
we may need
where we're going, there are no roads.
You may need somebody to come get you. And they'll transfer the patient, they'll transfer their spouse, and they'll put the spouse up while the patient's in the hospital, and then they'll fly you back to where you came from or fly you home. Pretty darn good coverage for that. It's just peace of mind, too.
Here's the best part. Sorry. That junk that's offered on the marketplace here in the United States is just crappy health insurance at an overly inflated price.
And we were looking at like $1,100 to $1,400 premiums for the two of us for just health insurance. Yeah. Not all of this other stuff.
She's 36 years old right now, and I'm 41. Yeah.
So then it also covers health and well-being, which is like immunizations and mammograms and all of your stuff to keep you healthy, preventative stuff. Yeah. Then it has vision and dental. So you get an eye exam every year, glasses every other year, dental exams and cleanings every year, and any dental work that you need done.
I was kind of shocked when it included
all of this for
dental
$897.
And vision for like $900.
The other really cool thing, and this actually is a feature that swayed me towards Cigna versus the other plan I talked about, is that as part of the emergency evacuation insurance, they pay for what are called compassion visits. So let's say Ben gets really sick and he's in the hospital in Paris. They'll fly one of our parents out to see him. Give them a place to stay while they're there and fly them back home so that they can see.
That's unheard of.
It's insane, right?
Yeah, I don't know if the rest of the world has insurance that's this good, but in the United States,
no.
Come on, you're screwed.
Yeah. So now that brings us to another point about this health insurance. One of the reasons that our premium is higher is because we chose to include the emergency evacuation, the preventative care, the vision and dental. Those are all a la carte things that you choose, what you do and don't want. And then you can choose whether or not you're covered in some of the really high cost places in the world for healthcare. So that's like Japan, Hong Kong, Singapore, and the United States, give or take. If you want year-round coverage in those places, you have to pay extra premium. We chose to do that because if
we're
you
American.
If you don't, then you can only be in those high-cost centers for up to 60 days a year, 3 weeks at a time. And it would be fine for just about anywhere else in the world, but because we're from the United States, if we want to come home, we don't want to be like on day 20, gotta get out of here. We have to be able to
run
stay.
From Mexico.
Yeah.
We can't stick around.
We have to be able to stay as long as we want. And so we opted to have U.S. coverage as well. But if you aren't from the United States and you might just be visiting here, you wouldn't need that. And the price would be about $150 a piece less per month.
So now you totally jumped into all this research. How did you find all these health insurance options that covered us internationally?
Well, so I did some research first with the International Living magazine because
she loves that magazine.
I'm totally addicted. Like, ask Ben when it shows up every month. I'm like, yay!
And it doesn't even show up every month because we're travelers, so we get mail drops.
I'll get like 3 of them at once, and then I'm like, just leave me alone. I'm gonna go read, and I read it cover to cover. But International Living. The expat websites that I belong to, the expedition vehicle companies, a lot of them recommend Cigna. And so that was the first one I went looking at. But then I thought, okay, well, you can't take the first thing you see. So I started doing some research, and I actually found this article that we'll share in the description section below. But it listed out either 10 or 14 different companies that offer international health coverage. And so I went and asked for quotes from every single one of them. And so the bottom line was that it wasn't that Cigna was the cheapest, but it provided us the most coverage for the dollar amount we were going to pay.
So also, just because we like to share, squeaky, first video, I'll fix that. Just because we like to share real life and like both sides of the coin here, there are things they can rider. Just like in the United States, they're going to rider things.
Well, this is the U.S. company. They'll rider you.
Okay, well, they ridered things.
Yep, they did. And there were some things that we were expecting, and then some things we were like, are you effing kidding me? It was unbelievable.
Like my back.
We knew that was going to happen.
Yeah.
We totally knew that was going to happen. And I'll share something really personal. I had a breast lump last year, and it was completely benign. I just have fibrocystic breast disease, and they switched my thyroid hormones, and that's what made it happen. And I had to go have the whole workup done. Well, they ridered my benign breast lump, and we're like, are you kidding? Like, what?
No, they actually wanted to rider your breasts.
I know. I was so mad. I'm like, I can't take health insurance that they're not going to cover my boobs. So, anyway,
boobs and backs are rider, guys.
We got them to put in writing that if I got cancer or it was something not benign, that they would cover it. It was only for the benign breast lump I had.
And we can also appeal after 1 year, because, I may go to the chiropractor once
in a while.
Yeah. I can't even remember the last chiropractic visit I went to, but you have to be honest on your records, and I've been clumsy over the years, and I've hurt my back.
Yeah. And so that was the thing that I went back and forth with them for a while, but they finally said, okay, this is covered, and in a year, you can appeal these things. So we went with it.
All right, so this video is getting rather long.
It is.
Nitty gritty, Cigna is who we're going with. We'll put all the stuff in the video description below. Any closing thoughts?
I'm just looking here through my notes to see if there's anything else.
The whole world is ours.
Really important. If you are going to be getting a long-term visa for any countries, then you need to go look at their requirements for health insurance before you purchase health insurance. Example, Germany offers long-term visas, and it's apparently one of the better countries to get a long-term visa from, but then they require that you get their insurance from Germany, which won't cover you all over the globe. France, on the other hand, just has parameters on how much coverage you have to have while you're on a visa with them. And so it's a better option. So be sure before you buy any health insurance that you go and look at the visa requirements that your country is going to have. Okay, battery's low, so 2 more things. This is not travel insurance. This won't cover you if you lose your luggage, if your trip gets interrupted, if you need a place to stay, or whatever it is. That's not what this is. This is health insurance while you are traveling.
Yes.
Okay? And then the last thing is that you can buy different levels of coverage. So if you are a healthy person or you don't want to have such high premiums,
you can pick and choose and dial it in.
Yeah. For us, I really liked the big one, the one at the end that said covered in full, covered in full, covered in full. So we went with the premium plan that they had. But it's very malleable. You can pick and choose what you want and make it what you personally need, which is really cool for health insurance.
Are we done?
We're done.
I think our battery's done. All right, guys, we are going to be traveling the world very, very soon, and we're going to make videos the entire way. So make sure you hit that subscribe button, leave a comment below if you have any questions, and that's a wrap.